Hello, Salome. Good afternoon.
Hi, Carlita. Good afternoon.
Hi, good afternoon, everyone.
How are you? Hey, Carlita.
Hi.
How are you?
Everything's fine here. And how are you?
Fine, thank you. But here is cold now. Not like yesterday.
Hello, good afternoon, everyone.
Hello, Liz. How are
Hi,
you?
Liz.
Hi, teacher. Hi, Carlita. Hi, Salome.
Hi.
How is everything?
Pretty good. Today the weather is cool, so I think it's good.
So we changed. Now it's cold here and a little bit cloudy.
Oh no, the weather is really, really crazy.
Yeah, that's right. Okay, I want to know if you can see my screen.
Yes, teacher.
Okay. So we're gonna start another lesson that is part of our jobs in consultation. Um, Maybe explaining is the best part because you have a diagnostic previews and you already know what the patient needs, but at the same time is a little bit difficult because in some cases you have to do some extra work explaining to patients. Am I right? Maybe in some extreme cases like accidents or something like that with bad news.
Yes, I think that always a bad news or some difficult diagnosis um, are such as a very difficult to say because you don't know how the person is going to react. Um, I think everyone has different reaction, and you don't know how the people are going to take that. So in all the cases, we have to be very careful. Be careful, sorry.
Right, that's right. That's the difficult part, right? But there will be some other cases where you will go and tell the patients good news. And for that reason, that this part is so important. I know you already know, but we're gonna just make a little um, watching here, okay? So, Liz, can you help me reading this, please?
Sure, teacher. Explanations. The final part of a consultation which should cover. First, diagnosis. Identification of disease from its signs and symptoms. You are suffering from, you've developed, you have, this is because, or this is mainly because, and this is why.
Okay, thank you. So you have here some introduction phrases that you can use to explain your patients about the diagnosis. Okay, I don't know if you want to add some other way to say or to introduce this diagnosis.
Maybe one thing that is common and I've heard is when the doctor says we found a specific thing, for example, a tumor or whatever.
Mhm. Okay, that's another way. I don't know if you, Carlita and Salome, have another way to explain.
And sometimes when the diagnostical is not final, some doctor says we think that is this, but we are not sure, so you need to make more exams or something like that.
Okay. Okay, that's good.
Yeah,
Well,
here in Bolivia, we say, like in Ecuador, we found out that you are this type of tumor or something like that. It's the more typical way to say it.
right. Okay, thank you very much. Let's continue then. Carlita, can you read this part, please?
Sure. The management plan, including investigation and treatment. I'll make you an appointment with. I'm going to start you on medication too. I'm going to have you admitted too. I'll arrange for you. You'll be given. I expect you'll have. They might advise.
Okay, thank you very much. I don't know if you can add some other phrases that you can use or that usually use. Or if you have some questions.
Maybe we said I'm gonna prescribe some medication.
Okay. Yeah, we can add that.
Maybe I will refer you to the ophthalmologist.
Yeah, that's a good way to say it too. If you, it's another way to say I'll make you an appointment with, right?
Exactly.
So good. Okay, there is another some questions about this part, or it's understood.
I think it's clear.
Yes, teacher.
Okay. Okay. Perfect. Let's continue then. And Salome, can you help me please with this?
Sure, teacher. 3. General advice about changing lifestyle that may be needed. The nurse will give advice on you should try to give up. I want you to. It's important that you.
Okay, thank you. In this part, I know there are so many other ways to say another advices. I don't know if you want to add something else.
Sometimes when the patient are in the limit of some situations, we usually say if you don't, for example, take your pill at the time that is, you will have um, more probably to die or something like that. Like trying to be to the patient be conscient to the situation.
Okay, that's good. Is that okay if we use the word, I suggest you to do this or to do that?
I think
Yes,
yes,
I
we
think
use that too.
Okay. Another way.
as Salome says, it's some patients need to be very. We have to be very strict with them, like saying if you don't do this, you can get worse. Yeah, it's a lot of situations that take that like strictness in in our words.
Yeah. Yeah, I think it is the most common and useful word. I don't know why people used to hear the advice just when we are tough with them, right? They not take it as a suggestion, as you want to help them. But when you are so tough and you get mad at them, that's the way they work. Or am I wrong?
Yeah, yes, because they get scared because they see the real situation. Because if we suggest them, maybe they will say, it was a suggestion. Maybe it won't happen, right? So yeah, we have to be tough with them sometimes.
Yeah, I think most of the time. But it's for their health. So I think it will work with them. Of course, you're not gonna yell at them, right? But you have to say something maybe more tough in a way that they can understand.
Yes.
So Liz, please, can you read this?
Yes, teacher. 4. The prognosis. What is likely to happen because of a disease? Stressing that nothing is certain. I expect the treatment will. Hopefully we can never be absolutely certain about. You should remain optimistic.
Okay. What about this part? The prognosis is something difficult for you, I think. How do you manage this?
I think it's difficult because we expect one thing or we expect the best results, but we don't know how the patient is going to react, how the treatment is going to act in the patient. So I think the most difficult part of this is because the patient um, has too many hope in when we say one prognosis. And if we say something wrong, or maybe we say you are gonna be okay, and it won't be like that, you will have problems.
Yesterday we were talking about the ethical part, and we already talk about that unit before with Carlita, right? Yesterday, and I don't know how do you manage this. So it will be better if you say something not partial, or it will be better if you make your patients feel positive about their conditions.
Yes, I think the idea is that we have to put the mind of the patient as a positive way, like you said, but we don't have to give some hopeness or hope. What I mean is we don't have to say you're gonna be okay or you that treatment will work. We have to say only try with this or take the pills and we are gonna see um, um if you are better or I don't know. Maybe with the time we are gonna see how you are.
Okay, thank you, Liz.
Yeah, here in Bolivia, it works like that too. But some doctors prefer to say the bad situation first, like in COVID. Say the 80% you have the chance, the 80% of chance to heal well, or and you have the 5% chance to get worse. So you tell the patient the two situations, and that's how you cover ethically your work, because you told him that it can get worse. So yeah, it's a way to take care of your back, like professionally, right? But it's always using the medicine based on evidence. that you have to work with numbers, because you cannot just say one number that it's not right, right? You have to prove it with investigation.
Yeah, that's right. I think the same.
In a way, Liz and Carlita are right. I think too that we have to be careful more than the patient with the family of the patient, because the patient could be understand more that the situation that his or her happening, and how is the evolution of the situation. But sometimes the familiar don't believe that the team of health are doing all the possibilities for the patient have a good progress in the disease. So I think more carefully have to be the team with the family.
Thank you, Salome. I don't know if you heard that sound, guys, or just me.
Yes, Salome, I think something it's in your ventilator, maybe.
Yeah, it's happening there. That's supposed that today I don't have to turn my computer.
Oh,
Sorry, it's dying my computer,
oh
but
my God.
I have
Don't
classes.
worry. I know, don't worry. I just want to know because
You want
something
to believe I am crazy.
sometimes or most of the times yeah, happens that it's something from my computer, my internet is bad. Yeah, I know I have a low battery or something like that. I thought it was me. So it's okay. Okay, so in conclusion, I think this is the most difficult part, maybe, of the explanation, the prognosis, right? As you said, it's better if you say both parts, but people won't understand very good as the patient's family. Sometimes happens that people get mad and just don't want to understand. Maybe they understand and they know about that, but they think that we can do something else for their family, and it's difficult for that reason. But I think you're gonna be okay with your prognosis in the future. As I can see, you are so clear with that. So I hope you don't have any problems of that kind. Okay, let's continue then. Okay, the worst part, I think, question time, where the patient can ask questions about his or her illness. Do you have any questions? You may say, is there anything you'd like to ask? And I want to know which one or which ones are the most common questions you are receiving all this time.
How many times I be here in hospital? That is the most common that I listen to my patients.
Okay. Okay, what else? Because
Sometimes
I think, oh, I'm sorry, continue.
sometimes the patient want to know what happened if the first treatment don't have a good progress. What is the other option for them?
I think another question is that the patient wants to know um, where he or she get the illness.
Okay. In which cases specifically?
For example, in gastroenteritis,
Mhm.
they always ask where do you think that I get sick, or with what food, for example? So you're like, what did you eat? And then you have to explain.
Okay. Another question?
No, teacher.
Okay. I think those are the most common then. Well, that's not that worst. I thought it would be so with so many questions for the doctors and nurses. Okay. In this part, Carlita, can you read this, please?
Sure. Using lay terms in explanations. Explanations should be given in words the patient will understand, avoiding medical jargon. Using lay terms. Words familiar to people without medical knowledge can help patients understand explanations. For a list of some common lay terms for conditions, parts of the body and medication, and how I say etc. in English? Sorry, teacher.
Etc.
Etc. Ah, okay,
It's a little
thank you.
bit etc. You can say etc.
Okay, thank you, teacher.
You're welcome. Okay, any question here? Maybe do you know the meaning of jargon?
Yes, it's like jerga como el vocabulario normal.
It's the same. That is jargon. Okay, so as we can see, we have to use lay terms to explain our patients that actually are easy terms for the patients, right? Okay, here we have 4 paragraphs, but we're gonna take the last ones as one, okay? So Salome, can you read this one, then Liz, and the last one, Carlita, please?
Sure, teacher. An explanation of angina. Having examined you, I am confident that you are suffering from angina. Is correct pronunciation angina?
Angina.
Angina. Okay, angina. The hair is the pump. The more you do physically, the harder it has to work. But as we get older, the blood vessels which supply oxygen to the hair begin to harden and get furry up. So they become narrower. They can supply all the oxygen the heart needs. The result is the pain you feel as angina.
Because you are experiencing pain at the rest as well as on exertion. I am going to have you admitted to the coronary care unit right away so that your treatment can start at once. You'll be given drugs to ease the pain, and I expect you'll have an angiogram. They may advise surgery or angioplasty. That's a way of opening up the blood vessels to the heart so they can provide more oxygen.
You should try to give up smoking. You won't be able to smoke at all in hospital, so it's a good time to stop. I expect the treatment will improve your pain at least and might get rid of it completely. We can never be absolutely certain about the future, but you should remain optimistic. Do you have any question?
Okay, thank you. So this is a resume of what we are already seeing, right? We have the diagnosis, we are making an explanation for the treatment, and we have the prognosis part and the question part. So do you have any questions of vocabulary here, maybe?
I have one question. In the first paragraph, in the third line, the first word, furrowed up.
Furrowed up?
Yes, furrowed up.
But as we get older, where are... Let's check. Okay. The translation here says that it's to get mad or furious,
Mm-hmm.
right? But it doesn't make sense.
Mm-hmm.
Maybe. Oh, it's like endurecerse, to make it harder with the time, right?
Como fibrosis.
Yes.
Uh,
As we get older, yeah, the blood vessels which supply oxygen to the heart begin to harden and get furrowed up.
mm, no. Thank you, teacher.
You're welcome. Mm. What else? Do you understand the word exertion? In the second paragraph, first line.
It's like effort.
Right, it's like an effort. Okay. Do you have any questions?
No, teacher.
No, teacher.
Very good. And this part, discussing treatment and offering options. There are a couple of options we can use. First option is to try tablets like Prozac that lift you up a bit. The other option is counseling. It can be caused by diet or stress. There are some quite simple tests we can do. If you're still concerned, we can refer you to a hospital. Someone can tell me what is Prozac for?
I think it's an medical treatment for depression or anxiety, if I'm not sure. Well, let me search.
Okay, like diazepam and alprazolam.
Yes, yes.
Okay. So we have here an example of for offering options for treatments, right? Can you give me for any kind of disease you want some options?
The most common, for example, for high blood pressure will be losartan in Ecuador.
Okay. And what will be another option? Maybe before
Enalapril.
and maybe before they use those tablets.
We
What?
have two options:
Okay,
losartan and enalapril.
okay,
Then we can combine with a diuretic, but depends of the patient.
okay. And if, for example, I we're discussing a treatment, okay, and in the first place we say to the patient to change her nutritional habits and her lifestyle, maybe as an option. And another option will be if it doesn't work by the time we are gonna start giving you enalapril or losartan. Can it be an option too?
I think could be an option if the patient don't doesn't have um, medidas like numbers so high of
Okay.
blood pressure. But if the patient come to our consultation with I don't know, maybe 3 days, each day he or
Mhm.
she take the blood pressure and the numbers are very high, we definitely have to begin or start with a treatment, and obviously combine with change of a lifestyle and nutrition.
Okay. So, for example, then, can you give those tablets or those pills combining maybe in first place just 2 times a week? I'm just saying, okay, 2 times a week. And if it doesn't work, you have to give her maybe every day or something like that. It works for
Yes,
us.
sure. In fact,
Okay.
we start with a half of a tablet, and if it doesn't work, we start to increase the doses.
Okay, excellent. Maybe Carlita and Salome has another combining treatments.
Maybe for urinary infections.
Okay.
We here in Bolivia we give the nitrofurantoin. I'm not sure how to say it.
Yeah,
in,
that's good, but it's so so
yeah,
hard that one,
that's that's
right?
the first option, right? But the most of the people it's resistant to that antibiotic. So here the second treatment is the cephalexima. So we give the two options, but it depends if he or she responds to treatment, and that's are the two options in Bolivia's protocol.
Heard about the first one. My sister used to take those pills when she was 8 years, maybe 6 years old. It was so hard for her, so tough for her. That's why I
Yeah.
don't like it.
Yeah, and we have a lot of cases that we have recurrent urinary infections. So those are worse because they get an income patient and they have to be hospitalized to be treated.
Yeah, that's right. Okay, thank you, Carlita. Salome, can you add something or it's okay?
Sincerely, I don't know the combination of medications, so if I say something wrong, I think it's better don't say.
Okay, don't worry. I was maybe asking, like, maybe like me, right? If you can use this one and I know Carlita and Liz will explain to us.
Yeah.
Okay, so don't worry. Perfect. Let's continue then. Uh-oh, sorry. Okay, so Salome, can you read this, please?
Sure. Advising a course of action. When advising course of action, doctors may say, some time of work might help. If you feel that will be helpful, you could take a week and see how you feel after that. Carry on loss of fluids. If you still have some pain, you can keep taking paracetamol. Other thing might help, like raising the head of your bed. That's one of the simple things we could start you off with. You said you haven't tried digestion remedies. That's something you could try.
Then you have another kind of advising. Maybe you usually use. For example, I have an stomach ache and I go to your consultation. You give me what kind of treatment? Maybe with a, not with vomits and with fever.
I think if you have fever, you have to make a laboratory exams firstly.
Okay.
And depend of the results, maybe have a treatment with medication.
What will be the most common thing you can find out in the laboratory results?
I don't know. Liz, Carlita, can you help me, please?
The most common one, I think it's E. coli infection, um, gastroenteritis. Yeah, and if it has fever, we have to treat it with some antibiotics.
Okay. So I'm gonna take what kind of antibiotics?
Well, here in Bolivia, we when we get internet, we use the ceftriaxona, maybe.
Okay.
Yeah, we give it per 5 days in income patients. Yeah, and offshore, and it will be accompanied with a white diet that
Mhm.
it's all boiled food, nothing fresh, um,
Okay.
and without spices or nothing. It's just plain food.
Okay, thank you.
That will
Then
be an advising course of actions, right? I think.
you're right. So I think that maybe I'm not a good patient, okay? Let's say that I'm going to take the medication and I will do what you're saying, but I think not correctly maybe because I it happens that I will go back to your consultation with the same problem but in the less grades. What do you say to me?
Without fever or
Without
how?
fever, without fever, just the pain, just the stomach ache.
Okay. Well, it might be something that you ate and irritate your gastrical mucus. So if it's tolerate, you can take omeprazole every 12 hours per 10 days. And if it doesn't solve it, we have to make another studies because it can be an ulcer, gastrical ulcer, maybe. Yeah. But the treatment always, if you have just an stomach ache, is because, and you say, I ate pork yesterday with a lot of condiments and it was New Year or
But
something like
remember,
that.
I am going to lie to you. That's what patients do. Okay, no, I ate what you said to me, and I still have.
Yeah, and when they come like that, you just, if it's hurting a lot, you give them ranitidina. But if
Okay,
it's not hurting so much and they can take a pill at home, so it's and you just send them at home with omeprazole. It depends of the degree.
okay. Thank you. Something else you want to add, Liz? Maybe.
For example, in the context that advising occurs, I think one advice could be when the patient has to take antibiotics, um, it's important that the patient eat something before to take the pill. For example, with azithromycin, the you may have a really hard stomach ache if you take the pill with the stomach empty. So I think that's a good advice. Eat something, and then in 30 minutes you can take the pill.
Okay, perfect. Thank you. I feel better now. I don't have an stomach ache. Okay, Salome, can you read this, please?
Sure, teacher. Advising patients to avoid something. When advising patients to avoid something, doctors may say, there are a few things about your lifestyle we could address. Perhaps cut down on the amount you're drinking. Giving up smoking will help. Cut off fatty foods. You should try to avoid thick clothing, sitting in deep
Hi.
armchairs, and bedding, especially after meals.
Okay. Okay, thank you very much. Okay, in this part is almost the same, right? We're just giving advice to our patients. Maybe for low symptoms or signs that we can just manage in that moment with advisings and not with treatment medically, right? In which cases you use this kind of advices?
In patients who have um, high weight or have a problem with them liver, the most common.
Okay. Okay, excellent. Another suggestion, guys?
I think in primary consultation is very useful all that kind of advising because you don't have too many medication to treat something and you have to use what you have or the patient have has, sorry. So maybe some advices, even natural medicine could help. I think the most part of time we have when we work on hospitals, we have the facility that we have a lot of medication, and sometimes some doctors forget to give those advice that maybe could help, or maybe could prevent that the people take pills. So I think in the primary care center, the advising are very, very important and basic.
That's right. Okay. So it happens in your consultations in primary care that, for example, as a doctors and nurse, you have to give um, some amount of medication per day to patients. I don't know if it's a rule or something, and that in your own that you can just give them advices, but in the hospital or at hospital they tell you that you have to give them an amount of pills or medication just because the patient feels sure about their treatment. Is that
Well, sorry, teacher, what?
uh, for example, I don't know if you in your consultations give your patients an amount of medication just because people tell you in the hospital that you have to give them. I don't know if it's a rule,
No, it's not a
but you
rule.
have
It's not
to.
an obligation. But Mia, sorry, teacher.
Don't
But
worry.
it's not an obligation. But when you prescribe in hospital or the primary center, as you that prescribe a limit number of pills. For example, if the patient needs the treatment for 1 month, we have to
Mhm.
prescribe 30 pills, for example. But I have the problem that in primary care center, we don't have enough pills. So I have to prescribe only 10, and then maybe we have to say to the patient that has to buy or something like that. But as an obligation to prescribe something, no. But I remember now that with some medication that se va a vencer, it's gonna cut okay.
Okay.
They push to us that try to take off that medication as soon as possible.
Okay. So it's not a rule to give a medication. It's
No,
not an
like a
obligation.
rule, no.
Okay. What about you, Carlita? What do you say here in Bolivia?
Here, well, we have protocols here that in primary care we have a certain type of medication with in a certain number, right? Like in a, pretty much the same,
Mm-hmm.
but usually are the most basic ones, and it's so old protocol that some of those antibiotics we don't use it anymore. But by rule we have to give them, like if they say I have a problem and it goes like to say a pneumonia, we have to give them all that, we call it packages.
Okay.
Like we give them paracetamol, the antibiotics. If it's very bad, we give them an injection, and we give them all the packages to that person. I don't see it very well because we make our patients really dependent of medication.
Yeah.
And,
And resist.
and here in Bolivia, it's almost a law that we have to give them something, because they say I wasn't attended by the doctor if we don't give them something. So yeah, I think here in Bolivia, it's we have to give them something, even
Yeah.
paracetamol.
That's right. That's why I was asking you because I know working for the Ministry of Health, I have to give them at least ibuprofen, I had to give them in rural area, especially. Maybe because they don't have the chance to buy or find a pharmacy. But I had to give them. And and I don't know if it's correct, but I did it sometimes. Not too much pills, but I give them. Maybe with a recipe uh, mm, that tells them how many pills they have to take and in which cases they have to take this, because they do what Carlita says. The doctor didn't didn't do anything, and I feel bad, and they don't do nothing or something like that. Sometimes it happens. So it's so good that in Ecuador it is not the same.
But I think it's pretty the same because, well, like you said, it's not a rule, but indirectly, the state or the government give only a really small list of medication that we have to use. So I'm thinking better, and I think it's not an obligation, but if they don't give us I don't know, too much medication, we have to use only that. So it's like a rule or indirectly.
Yeah, that's right. Because the next time they won't give you anything because you don't use the medication, right? But
Yes,
it's relative and they don't understand, because I
exactly.
think they
Because,
are just administratives, and they are not doctors or health personnel, right?
that's right. Because if someone has some pain, we have only paracetamol and ibuprofen. We don't have more.
Yeah,
Mm-hmm.
our glorious pills. Okay, Carlita, can you read this, please?
Sure. Warnings. When a doctor wants to warn a patient that consequence of ignoring the advice will be serious, he or she might say, if you aren't feeling better in 7 to 14 days, you really must come back and see me again. If you need damaging it, you're going to end up with a long term problem. If you feel that things aren't settling, aren't getting back to normal, it's important that you see me again.
Okay, thank you. Yeah, in this part it's the same, right? I don't know, but I saw, maybe Salome knows, that when you give these warnings, you have to write down in a book that has a copy that help us avoid problems with the patient. Maybe the doctors didn't give me anything. I don't know how to use this or how to take this. And you can look for that page and say, yes, here is it. I already give you, right?
Yes, dear Cherry. And sometimes in some hospitals after the patient go out to at hospital, go to home, we make a post consulta. Uh, I don't know how to say in English, and
Post consultation.
post consultation, and we explain all the patient to the patient how took the medication, the preventions, the hygienic that have to have, and we and the patient signet a paper
Yeah.
that we are communicating all the things for that you say care about us in case.
Okay. Okay, that's good. And I want you to have in mind that these papers are so much important in these times especially. Don't forget to write anything, everything. Okay. And Liz, can you read this, please?
Sure, teacher. Giving bad news. Principles of giving bad news. First, give warning. I am afraid your test results aren't very good. I am sorry to have to tell you that NIWA isn't good. 2. Choose an appropriate setting and have a friend or relative of the patient present. 3. Take time. 4. Use appropriate language. 5. Emphasize the positive. There's still a lot we can do to help you. Chemotherapy will make you more comfortable. And 6. Discuss the prognosis. One can never be certain about these things, but I say it's a matter of months rather than years.
Thank you. And I'm sorry. I like to eat some some letters.
Don't
Okay.
worry, teacher.
Okay. So I don't know if you have another way to say to give bad news. Maybe something is missing here. And before I forget, Liz, you were asking about fecha de vencimiento, right? It's due date. D
Due date.
DUE.
Okay.
Due
Thank you,
date.
teacher.
Okay, so I think it's pretty much understood this. You have your own ways to say it.
Yes, I think we don't have a specific phrases. In my case, it's like, you are in the situation and just the words start to fluir.
Yes, just come out.
Yes, so I can say that I am have a specific option or phrase. Just happen.
Yeah, that's right. It depends on the situation. And I will add the 7, 8, and 9 point. Supplement the verbal message. I'd like to record this consultation so you can listen again if anything isn't clear. 8, arrange a follow-up session. I'd like to see you again next week. Can you come in again next week? And 9, confirm that the patient understands. Could you tell me what we're going to do for you? Is everything clear to you? Okay, maybe those finally questions are important. And I think you usually ask to your patients, right?
Yes, teacher.
Excellent. And this is a brief um, consultant medical oncologist report, just to know about it, okay? Maybe, Liz, can you read it, please?
Yes, teacher. A consultant medical oncologist report. Mr. Harry Scott. Diagnosis: previous pancreatic cancer. I reviewed Mr. Scott in the oncology clinic today. He has been less well and has lost 12 kilograms in the past few months. Unfortunately, His CT scan shows an area of ill-defined low attenuation in the tail of the pancreas. Although this is consistent with focal pancreatitis, the general feeling at the multidisciplinary team meeting was that this represents recurrent disease. This is especially likely in view of his clinical deterioration and rising CA 19.9. I discussed this with Mr. Scott and his wife. He was obviously disappointed with the scan results, but still tries to remain positive. We discussed the fact that surgery wasn't an option and symptom control was important. We also discussed the role of palliative gemcitabine, the potential, what teacher?
Gemcitabine.
Gemcitabine. The potential benefits are small, but it is usually well tolerated, and he has named to proceed with this. I will therefore book him into Ward 2 to start treatment in the next few weeks and have rechecked his bloods today. In the meantime, I would be very grateful if you would refer him to your dietitian. He himself is keen for this to happen. We will see him back in clinic once his treatment has started.
Okay, thank you. I don't know if you have some questions here for vocabulary, especially. Keen for example, it's like dispuesto, okay? That it's prepared to.
Thank you, teacher. I was searching for that word.
Yeah, the translation it says ready, right? But it's more like dispuesto in this context. Okay, so I think we don't have any questions.
No, teacher.
No, teacher.
Okay, so thank you very much, guys. I will share with you my little questionnaire. Please fill it for me.
Done, teacher.
Okay. Okay, so who's going to be first tomorrow?
Can I be first, please?
Liz?
Yes, teacher.
Okay. And then?
Can I be the second one?
Salome.
Yes, teacher, please.
Yes, don't worry. Okay, Salome and Carlita.
6:30.
6:30. Right. Okay, so I will prepare a little test for you for next week, okay? But it will be easy as I can see. You are so prepared, so I think it won't be hard for you to solve it, okay? But I ask you to practice a little bit, please, and read what we were watching those days, please.
The test is about all the units that we have seen.
Yes, but as I tell you, it won't be so hard because okay, I won't put some words that we maybe forget, okay, with the
Okay.
time, but I would like you to write down maybe some words, some new words, okay? That's why I ask you to give a watch about that. Okay?
Okay, teacher.
Okay, see you
Okay, teacher.
tomorrow then. Thank you.
See you tomorrow. Bye,
Okay.
everyone.
Goodbye.
Bye, teacher.
Bye.
Bye.
See you.
Bye.
Bye.